As we all know, in neonatology, the newborns have a lot of scope to have identification errors. To prevent this, in our unit, we have a 3-level of identification process for the babies. The first being, whenever a baby is being delivered, before handing over the newborn to the relatives, we place a name tag on the baby which contains all the details like the name of the mother, the birth weight of the baby, the sex of the baby, etc. Secondly, if the baby is being admitted into the neonatal ICU, apart from the previous tag, we also have a nameplate on the bed where the baby is being received and admitted. Thirdly, which we have recently started, we have a patient relative identity card which again contains all the details of the newborn, in addition to which we have the name of 2 relatives who will be attending to the baby and to whom the details of the baby will be communicated at times.
As a part of improving effective communications from the patient side, we have implemented a medication reconciliation form. The main aim of this form is to collect patients' past medication history at the time of admission, during discharge and also after reconciliation. After collecting the data, we are thoroughly cross-checking about the informations and discussed with the concerned physician. This type of activity helps us to avoid errors like drug duplications, omissions, drug interactions, etc. The other important safety is about high alert medications. We have implemented that all the unit of high alert medications in the locations where it is clinically utilized and stored should be labeled with the sticker of high alert medicine. Apart from this, we are also checking for the appropriateness of prescription, storage, double checking and also monitoring after the drug administration.
We can reduce the incidence of fall by multidisciplinary approaches and teamwork. Here we are following few interventions to prevent patient fall. That is, identifying all the high risk group at the time of admissions, regular safety rounds to ensure that all the safety aspects are in place like availability of side rails, seat belts on the transferring vehicles, adequate lighting in the patient room, nurse call system is available in the patient side. Along with our nurses are educate the patients and relatives properly on the measures of fall risk.
Improve effective communication. Now this has 3 aspects. One, with the patient himself, so that he feels comfortable and we explain whatever is his condition, whatever procedures or investigations has to be done with him. And the second part would be the communication between their bystanders, so to relieve their anxiety, to tell them what is going on, to explain the patient condition to them. And the third part would be the intercommunication between ourselves, that is our staffs and our colleagues. All these 3 factors would help to minimize the errors and to ensure a smooth care of the patient.